DriverCheck. Medical testing and assessments. One phone number, one stop, one step ahead.
DriverCheck's Occupational Medical Examination has three main goals. The first is to determine the medical fitness and/or medical qualification for duty status of an employee or job applicant. The second is to help employers and employees comply with mandatory medical examination and/or medical testing requirements contained in various governmental regulations, such as occupational health and safety regulations and transportation health and safety related regulations, among many others. The third goal is to determine the benchmark and periodic medical status of an employee and/or job applicant in order to identify underlying health conditions and risk factors and/or negative changes in health status over time in order to allow for early proactive intervention before significant medical problems occur. This program has the potential to improve employee health, to minimize the risk for unnecessary workplace accidents and illnesses, and to reduce unnecessary workers' compensation and general disability-related costs. Our medical assessment model focuses on job-related requirements and contains three main components. The first is a detailed medical history. The second is a comprehensive head-to-toe physical examination, and the third is all applicable medical testing. This includes detailed vision and hearing assessments, urine and/or blood testing as required, and cardiovascular, respiratory, and musculoskeletal assessments. Before the physical examination begins, we look at the examinee's medical history, specifically past exposure to hazardous substances or excessive noise, their lifestyle, and current or past health problems or medical conditions. After the questionnaire is filled out, the examining healthcare professional will go over the responses before moving on to the physical exam. This includes a vision assessment. It tests for far and near visual acuity, peripheral vision, and color and depth perception. Our hearing assessment looks for hearing loss, ear infections, scarring of the eardrum, and blockage in the ear canal that could affect hearing performance and warrant further investigation. If needed to meet regulations, a separate audiometric test can be performed. It measures how well the patient can hear. We can also monitor and track hearing loss through a comprehensive company-wide hearing conservation program. Through hearing conservation, baseline hearing is measured first and then compared to the results of future recurring tests. A urine sample is collected and tested for protein, blood, and sugar. The presence of any of these items could indicate an underlying medical condition that may require further investigation or testing. The cardiovascular component of the physical exam involves taking the examinee's blood pressure and pulse rate and listening to the heart for abnormal sounds. During our respiratory assessment, we check for abnormal breathing and impaired lung function. We also offer pulmonary function testing and chest x-rays to measure one's lung health and help identify lung disease or illness. Finally, the physical examination includes a musculoskeletal assessment, taking the examinee through a series of movements, looking for limitations in ranges of motion and visible joint abnormalities. We also test for carpal tunnel syndrome and assess balance and coordination. An advanced, detailed back and musculoskeletal assessment can be added to test the strength and flexibility of the spine, various joints, and supporting muscles. For more rigorous physical testing, refer to the DriverCheck tutorial on physical abilities testing. For more information, visit drivercheck.ca or call us toll-free at 1-800-463-4310.